are from the Center for Family Health, CEO Bill Wypiski and COO Sarah Benedetto. Welcome back to the show.
Well, thank you, Bart. Appreciate it.
Good to be here.
Happy New Year.
Thank you, too.
We've got a lot of cool things that are going to be happening in 2024, but I thought let's talk about last year. It was the arrival of Bill from Iowa. How do you like it so far?
I like it a lot. I can't believe it, but it's actually warmer here than Iowa, the western side, so that's great, but there's good snow. And I truly have been impressed by this community. I've been here, this is 8 months now for me, and the people have been great. There's so many wonderful organizations for us to interact with and collaborate with. And then the center itself, the team, the staff, our board, just all aces.
Well, you're lucky. I think Sarah and Molly and her team really left the center in good hands and really in great shape to turn over to you.
Absolutely. I feel that every day.
And as Bill enjoys the center, I hear from people that I know that are working in there and that are patients there. They're very excited to have Bill on board.
We sure are. Yeah, it's been great. It's been fun.
Yeah.
It's been lots of fun.
Yeah.
Well, we've got a lot of planning in the past year for some of the things that are happening this year. You had to get a temporary walk-in clinic.
Yeah. And that's something that I had a chance to literally walk into when I got there, because much of the planning had already been put in place. And Sarah certainly being in charge of a lot of that, among others. And we are excited. Our walk-in clinic over on Blackstone is going well. It's a temporary location. And at the same time, we have a lot of great construction going on in the building to double the size of what was our existing walk-in clinic. It's fantastic. It really is. It's going to help the community.
Yeah, you're a victim of your success.
I think, and I'll take it. I'll take it.
Well, Bill wasn't the only new addition to the center. You also had a couple leadership changes.
We did. Yeah, we had Dave Fierro, who's been our finance manager, was promoted to the chief finance officer. Yep. And then Michelle Lutz, our HR manager, is now our HR director.
Yeah.
So it rounds out our senior leadership team.
And I know you had some long-serving, dedicated volunteers on the board who termed out.
Yes.
You replaced them?
Yeah, we did. Stephen Hogwood, who was with us for a long time, both as a board member and then as the board chair. He finished up at the end of December. And we actually have a new board chair, Zoe Lyons, who has taken over.
Sarah's good friend.
She is a friend of mine,
Yeah. So she's really happy to be part of that. In fact, I'll see her in an hour or two. And we have 4 new board members. And if I have to remember to name all of them, I'll not do a good job. I don't know if we wrote that down.
We didn't, but I can help you if
Could
you
you
want.
help me, would you? All right, good.
Yeah, so we have Jacob Inocencio. He's probably been on the show. He's the director of Grow Jackson.
He'll be great.
Yeah, and then we have Elise, Anders from Henry Ford. She's in the finance department there.
She's great.
Sheila Troxel.
Over from True Bank.
Yeah, and now why am I blanking? Oh my
Shauna
gosh,
Tello.
Sean Tello from the
Yes.
Y, of course. Yes.
Yeah.
Well, you've got 4 very busy but excellent people that will serve the board.
Absolutely.
I talked to Stephen about a month before he left the board, and he was really sad to be leaving.
Yes.
He was a very hands-on board member and chairman.
Absolutely, very accessible, and I've had a number of meetings with him over at his office at the McDonald's.
His office is the West Ave McDonald's, or
Right.
Michigan Ave McDonald's.
Yeah, I think he has a real office. I know he does, but it was really great meeting him there. So, and I know that he wishes us well. We gave him an award on his way out. We had another person that left us, Karen.
She's from Hillsdale.
Yep.
Yeah, she joined us.
She was with us a long time. Both gave them awards, and so we wanted to wish them really well.
Nice.
Yeah.
Well, thanks to all those volunteers for their service.
Oh, yeah.
And the new guys, welcome aboard.
Yeah, absolutely.
A big year for the center and the number of patients that you folks served. You told me ahead of time. What's the number?
we landed better than 31,000.
Close to 31. Well, right now we're looking at 31,600,
Yeah.
Wow.
and this is the time of year that we are preparing for our big federal report, and so that's what we're looking at right now. We're finalizing all of our data.
Yeah. And those amount of patients also account for, I think is it close to 140? A little
Close
over
to 140, about 138,000
actual visits. So it represents a lot of work, a lot of care, and a lot of access.
Are you seeing a lot of the same types of health concerns and issues?
Yeah, I think so. I mean, we're certainly seeing a lot less of the COVID, of course. That used to be what we talked about all the time. It's still around, and it's still important to make sure that you are careful if you become exposed or if you become sick. But we're doing a lot more. We're able to focus a lot more on some of the chronic conditions that people have maybe hasn't been at the top of the priority list in the last couple of years, and so we really work hard to make sure that we're helping folks, meeting them where they are, and helping them to improve the status of their health, and so they can.
Yeah,
be
and speaking of
productive.
COVID, the health centers, the school-based health centers reopened.
Yes, exciting.
All 4 of them opened earlier in the 2023, just before
Right.
Bill arrived. So that was very exciting, and I know that our school folks are really happy to have us in their spaces. But again, those are open to everyone, so you don't have to be a student in that school. But
Right.
Yeah.
Absolutely. The other thing, just a small shout out, we've done, I think, an incredible job giving access to our patients in terms of our pharmacy. We're seeing a higher and higher utilization of that, which is great. On the way out, they can walk out and get their medications that's been prescribed, and that's a good thing for them. Easy and less barriers.
And I think we don't realize what we have here until we look what other communities have. Today in the Free Press, there's a story about Wayne County exploring the possibility of getting some funding to establish some school-based health centers.
Wow.
Yes.
Wow. Yeah. Wow.
So we're miles ahead.
Yeah, we really are.
You brought a word cloud. A word cloud of everything happening.
Oh yeah. Yeah.
yeah.
Wow.
Yeah.
This is basically all of the things that were accomplished, and probably missing some in 2023. So a few weeks ago, well, just before the holidays, we had a meeting with all of our leadership. And what we did is we asked for them to say, what are all the things that we accomplished? What did they feel that were accomplishments? And so this is our word cloud that we put together that highlights some of the things. There's a
Yeah,
lot
looks
there.
great. And supposedly, the more people that say a particular area, the bigger the word, right?
That's typically how it would work. In this case, we all just did it as an exercise together. So we
Right,
literally just had some. It was more like a brainstorm.
Yeah.
And I think our very skilled assistant Stephanie, who doesn't like to get acknowledged, Stephanie Cavender, took that and then put these together and highlighted the things that you see that are bigger. Tended to be the more, I guess, significant
Prominent
or
of sort,
prominent
yeah,
things, like our
absolutely.
walk-in move, for example.
Yeah, yeah.
The food program where we added fresh foods to our already existing food pantry. That was very helpful for our patients.
Yeah.
And I think we've got a couple of photos of some of the changes and new things.
Yes, this is our pharmacy robot that we purchased earlier in 2023.
They look very lifelike.
Yes, they do, don't they? They're kind of standing in front of it, but I always find I like having people are so much
We'll have to
more.
tell them that though. That's pretty
Yes,
good.
so that's one of our pharmacists, Jenna, and one of our techs, Kathy, there in the green shirt is Kathy. And behind them is our pharmacy robot, which fills over 60% of the scripts. It's a pretty slick operation. There's not a whole lot to see with it because it's kind of happens inside the machine.
That's right.
And this is our new walk-in that we opened earlier in December on Blackstone, 300 South Blackstone.
Yeah. And real proud of the renovation that went into this building. It had been an existing physician building with exam rooms and all that, but I'm proud of it only because I think it helped to I don't know, create a little bit more nice in the neighborhoods. Kind of cleaned up a lot that wasn't being well used, and we're just glad about the accessibility in that part of the neighborhood.
Yeah, it's really brightened up the neighborhood, and I've heard people say, I hope they don't leave.
Yes, we've heard that too.
We've heard that too.
Yeah.
But when you do open your walk-in clinic, it's just just a few blocks away, and you're going to be able to offer so much more because it's
Yeah.
going to be
It's larger.
bigger.
Yes. Yeah.
Yeah, it's good for the patients, good for the providers, which is great. We'll be able to separate out folks that are actively ill and coughing from the ones that aren't, and I think it'll be just a better space to see all the folks that we want to.
Sure, and we're able to, when we're located in a central location, we are able to provide a host of additional services too, and much easier. This space that we're in right now, it's great, but it's a little small for us. But our community health workers, our mental health therapists, typically will come down into our walk-in and assist patients as needed. All of our food resources are there. The diagnostic centers in our downtown office.
Pharmacy.
The pharmacy, yeah. So
the whole
yeah.
collection of items.
Yeah. So if need be, someone can be kicked upstairs right out of the clinic.
Sure thing. Yeah.
Exactly, exactly. It works really well. It is exciting for the community, and I know our staff love it. And I don't know, just there's a good buzz, if you will, going into 2024, and a good energy. So we really like that.
What's the other construction going on besides the walk-in?
Oh, well, pharmacy, yeah. We're going to have actually 2 bays that people can drive through to get their meds through a drive-up system. So we're all learning about pneumatic tubes and all that good stuff. But we're excited about that. It'll make just one more way easier. And folks that don't want to come inside the building, just grab their meds that way. Yeah.
How about services or clinical staff? What's your hope for this year?
Yeah.
I'm going to take that?
Please.
Well, we're really excited because just this week, we're kind of returning to our roots, and we hired a nurse midwife, the first of 2 nurse midwives that we'll be bringing on. So we're really excited to be bringing that service back into the center. Certified nurse midwives will be part of our OB team now, and our GYN, because they'll do both prenatal care and GYN services.
Yeah.
And we'll be having her on the show soon. I think she's scheduled to be on in February.
That's right. Yeah.
Nice.
She's a good hire, real good hire. So,
Well, I'll be anxious to meet her.
Yeah. Brings good energy, I think. I think the other thing too that I feel really proud about out of our HR department, our HR director Michelle Lutz and her team have done an amazing job recruiting, and we're at a good spot right this moment. Could change tomorrow, but right this moment in terms of filling the positions. We are actively recruiting for 2 OGBYNs, and we're looking for that. But otherwise, we're doing in a pretty good spot. And part of it is because as we're bringing people on, they're hearing the momentum, they're hearing the excitement, and they're hearing the kind of culture that we have with a set of values that resonate with them.
Yeah, I have a friend who just went for the first time a couple weeks ago, and they were just floored by the attention and the personal service, and they really felt welcome, and it's great to hear.
That is good.
That is actually really good to hear.
That's what we are striving for.
Every day. Yeah.
Well, keep up the good work, and thanks for all the updates today.
Absolutely.
Thank you. Thanks for having us on.
Yeah.
You bet. Leading the community to healthcare for all for more than 30 years, from the Center for Family Health, CEO Bill Wypuski and COO Sarah Benedetto.